Let's bring in the president of the Florida Ambulance Association, Terrence Ramatar. Terrence, good morning. Thank you for being with us. So I remember, and a lot of New Yorkers will remember, through March and April, the sounds of New York City, almost uninterrupted, of ambulance sirens wailing through the streets. What is it like in Florida right now? How busy are you?
Oh, good morning, and thanks for having me on. So we are seeing what has played out in New York, what has played out in Houston, beginning to take shape here in the state of Florida. Across the state of Florida, our ambulance services operate within these 911 systems. We're seeing an uptick in those 911 calls. We're working at a very high pace. We're also seeing some delays at hospitals being able to accept our patients. So our systems across the state, whether it's Orlando, Miami, Pinellas County, Tampa, are all experiencing this phenomenon.
Are you seeing, Terrence, shortages in PPE? What do you need? What do your drivers and what do your healthcare professionals need right now?
Well, thanks for asking that. One of our issues early on was PPE, and that has gotten solved. We are concerned about our ability to keep up with the expenses of the COVID-19 pandemic and what it does to the ambulance services. So, our biggest concern is being able to take care of our services financially. So let me tell you what I mean by that. Part of what we're seeing in this pandemic is a shift where patients are now calling 911, not only for transport to the hospital, but just for medical care alone. So some of them are afraid to go to the hospital. Some of them are afraid to go to a clinic because they think they'll get COVID there. So they're using our paramedics for treatment without transport. And they figure that out later. But we do not get reimbursed for those costs. So those are one of these items as we go through the pandemic that we're concerned about, that's bringing our ambulance services to a point of struggle financially.
Terrence, these people are heroes, your paramedics, and often they don't get that recognition. They put themselves out there, they're in danger, and as you so eloquently pointed out, that then you guys need help and backup. One of the most kind of impactful things that Joe Biden says in his campaign is that this didn't need to happen. And yet we're here again, which is impossible to believe, but we are here again in a situation that could have been mitigated. How are your paramedics doing emotionally, handling the hours and also the crises that they're consistently confronting?
Yeah, every day our first responders get up and they're walking into the fire. So, we think about them, we pray for them, we make sure they're taken care of, they have what they need. But what we are seeing here is an increase in the number of paramedics and EMTs that need to be quarantined for safety reasons because they've been exposed. So that's really taking a hit on our workforce. So we are looking at ways to reduce that stress. In addition to that, as the state begins to reopen and schools begin to reopen, our paramedics and their families are quite concerned about what's going to happen here in the next couple of weeks. They have the added stress of what's going on at work, and then coming home, having that stress, not only worried about whether they're going to bring the virus into their household and infect their families, but they are concerned about the future ahead. So we've been very supportive of them. We asked Washington to consider their needs as they continue to legislate and bring some relief, but their needs are top of mind.
President of the Florida Ambulance Association, Terrence Ramatar, thank you. And thank you to your paramedics for what they do every day. We hope Washington hears you. Thank you very much.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.